And good afternoon. Welcome to our live stream from the Duke Spine Institute. Our patient here is from California. He travels here with back pain and neck pain. He's had surgery on his neck in the past with a fusion, not done by us, but done elsewhere. Shot. And he presents now to us with pain in his neck, pain in his back, pain in his legs, symptoms in the legs, and we're trying to fix some things. One of them being he does have herniated discs at multiple levels. Shot. That includes the L1, 2, 2, 3, 3, 4, 4, 5, 5, 1. Shot. All right. I think I'm too medial. So the first thing I have to do is get access to these herniated discs in his back. Shot. And he does have a high iliac crest, so it's not making it easy for me to do. Shot. All right, that's better. Once we've accessed these discs, AP, then we're going to do our Duke laser disc repair to repair them. 5 discs, all with annular tears and herniations, all causing pinched nerves. That's very nice. You can see the spine has a mild degree of scoliosis, a little bit of curvature. He's got some degenerative disc disease as well. And we are not going to fix the scoliosis or the degenerative disc disease, but we are going to get rid of his back pain and leg symptoms. Shot. That's our goal. All right, just about there. Are you comfortable? That's my shot right there.
Yes, sir.
Uh-huh. Shot. So we're right at the back of the disc. You can see he didn't like that. So we're very close to a painful disc. AP, numb them. I'm going to numb up the skin a little more. I have to make an incision now. I told them we're going to have to do 2 incisions because we can't fix 5 discs with 1 incision. It's just, I don't think that's really possible. We'll try to get everything we can. That's perfect. So the first needle at 5-1 is in perfect position. I'm going to proceed. The reason we do 5-1 first is that it's the hardest to do. Always the hardest to do. Then I'm going to move from 5-1 to 4-5. Okay. Again, the incision is 7 millimeters. This is a very small incision. You guys ready for 4-5? Shot. All right, that's actually heading right towards 3-4. So might as well see if I can finish that one. Shot. Is that it? Uh-huh. So my intention is to treat 3-4, 4-5, 5-1 with this 1 incision. And this patient has herniated discs that are crushing his nerves here on both sides, but we're starting with the right side. He has too much to do with 1 surgery. I told him that already. So we've agreed to break up his surgery into 2 different surgeries. And one of the surgeries we're going to do today, let's go AP. The other surgery we're going to do on Thursday. Shot. That looks good. That looks really good. But his disc is extremely collapsed. As a result of the collapse, it's very hard to get the needle in. I will continue to try. You're doing great. So I feel it scraping along because there's so much arthritis in this disc. But we got it. Now I'm going to go back to the L45. Shot. Nice. Shot. That's better. Just need to get around that facet. You guys see how arthritic that facet joint is? Henry, I can feel the arthritis.
Yeah, we see it. Yes.
Yeah, literally right now I can feel how much arthritis there is. It's a lot of arthritis. Shot. All right, that looks pretty darn good. Shot. Let's get an AP. Give me a count. You ready? Oh, that looks back to a lateral. Wow. Uh-huh. I'm going to start a little bit more lateral. Shot. 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 That looks better to me. Shot. Any questions? Shot?
No current questions.
Is he reliable?
Hello, my friend. My friend, can you open your eyes?
Let's go AP.
Can you open your eyes?
So when the facet joint gets super arthritic, it gets enlarged. It gets to be about 2, 3, 4, even 5 times bigger than normal. That looks pretty good. Thanks, Luis.
I have a question for you, okay? Okay, please stay still on the bed. You're doing great. We're doing great.
Any pain?
Do you have any pain in your leg or in your back, sir? Huh? He said back.
Back. That's expected. Where do you feel that?
Right side of your back? Back, right side.
That's one of your bad discs, my friend. We'll get that fixed for you. Nice. All right. 3 down, 2 more to go. Now I might be able to get one more through the same incision. So we've gotten the 5-1, 4-5, 3-4. We got to do 1, 2, and 2, 3. I think we need to be a little higher, so I am going to just go with a higher incision. Let's do some numbing medicine. I want to numb him up. Going to give you a little numbing medicine. Don't move, okay? You'll feel a little burn. That's normal. That's just Novocaine going in. All right. Now I do start my higher disc more medial. And shot. Not bad. It's actually pretty good. Pretty good starting point. Let's see how that works. Numb them. We're going to give him some more numbing medicine. You're going to feel a little pressure. That's just numbing medicine. All right. So remember, this patient has 5 discs we're fixing, all from the right side. Okay? And that's kind of maxing us out, Shot, on what we can do in one surgery. I don't like doing anything more than 5 discs for several reasons. Most importantly, it's a long surgery. Patient's got to lay there for, hour and a half, sometimes 2 hours. Shot. Let's get an AP. So that facet right there was pushing my needle laterally away from where my target was. So the facet joint can push your needle away from your target. You have to be aware of that. You have to accommodate. You have to check, of course, your position, and then you have to make adjustments to your trajectory. You may have to make adjustments to your entry point. You have to enter maybe more laterally if your facet is enlarged, pushing your needle over. Right? See? Shot? Uh-huh. So, there we go. I was actually in Gainesville this weekend. Gainesville, Florida. For my daughter.
How did you like Miami?
She loves Miami. She loves Gainesville.
Oh, that's great.
She's excited about college. I'm excited for her.
Two good schools.
Yeah. Whenever you have a child who loves studying and sciences, what more can you ask for, right? I mean, at least for me, I'm happy about that. As a doctor, teenagers can be awesome. I worry about a lot of these teenagers. There seems to be a lot of teenagers just taking pictures of their half-naked bodies and putting it online. And it's like, what are we teaching our kids, you know? To devalue education and to value flaunting your body for money. I think it's a bad omen. But I'm glad my daughter's not a flaunter. AP. I'm happy about that as a father, you know, that she's not like a little piece of bait on a hook for a fish to come along and bite. Okay, looking good. Actually, we chose two very nice entry points. I think they'll serve us well for the case. I can't imagine doing it any different. I'm very pleased. Patient's doing good?
Yes.
Doctor?
Comfortable.
Uh-huh. Is he awake and reliable?
How are you doing, my friend? You said good.
We're going to put you to sleep in a minute, but I need your help. All right, we're in, like Flynn. So, Henry, well, let's go ahead and we'll do the discogram, and then we'll put the patient to sleep, and we'll run the video on why do herniated discs even cause back pain? You know, how does that work? How do they cause leg pain? A lot of people think herniated discs pinch a nerve, and that's how they cause back pain, but that's not true. It's absolutely wrong. How do herniated discs cause back pain? It's from inflammation within the herniation, within the wall of the disc. It has nothing to do with a pinched nerve. When you pinch a nerve, it causes leg weakness, numbness in the skin, and tingling. It does not cause back pain. That's a pretty picture, Jordan. You can see we've accessed all 5 discs that we're fixing. 1, 2, 2, 3, 3, 4, 4, 5, 5, 1. Our patient has had back pain for how long? 37 years. Lower back pain, 37 years, folks. You guys see that, Henry? 37 years.
Yes, we do.
Can you imagine having a cold for 37 years or having a flu for 37 years? How about having a toothache for 37 years? It's unimaginable. But that's what people go through when they have back pain and their doctor doesn't know why. They tell them there's nothing that can be done. You need to take pain pills. Come back every month and get a refill. They tell them to do shots that don't fix anything. Okay? So our poor patient has suffered with back pain for 37 years, like so many of them. And they come here to get fixed. Now his back pain in this area right here. And lo and behold, we've got 5 discs in this area that are damaged. L5-S1, L4-5, L3-4, L2-3, and L1-2, right? 5 discs. I'm not going to write it all out. Are you comfy? Yes? Wonderful. We're going to put you to sleep in a minute. No pain? You having any pain?
No pain?
How bad is that on a scale of 1 to 10?
7.
The highest it goes. What's the highest? What's the highest it went? 7. Is that where you typically get back pain? But you get it in that area? All right. So we had 7 out of 10. Good job. You've been very helpful. I'm sorry that that's uncomfortable. It's concordant. Okay? Remember, you may not have this pain every day, but do you have this pain ever? Is this a part of your back pain complex? That's what we want to know. Which one did I do? This one? So I'm going to take that out. Give that back to you. By the way, folks, the blue dye is the Duke Spine Institute blue dye. It's used to find degenerated discs. Are you better? No pain?
Pain on the right side.
How bad is that on a scale of 1 to 10? How high does it go? What's the highest it goes? 10? All right. Is that where you've gotten back pain before? Good job. That's 10 over 10, concordant, L4-5. So we got L3-4 is a 7 out of 10, L4-5 is a 10 out of 10, both concordant. I'm sorry about that. The good news is that pain's going to be gone forever when you wake up. Completely gone. That pain.
He's watched a lot of videos too, he told me.
Have you seen me do this before on other people? Yes? And yet you still came here. Right? He's watched me do. How many of my surgeries on other people did you watch? 6 or 7. Good. That makes you an expert. All right. Well, you know that we're about to put you to sleep in a few minutes, right? But you know we're not done yet. Are you comfortable? How bad is that on a scale of 1 to 10? 10. Is that where you typically get your back pain? All right. So, 10 out of 10, concordant, L5-S1. That is where he gets his back pain. He gets his back pain in a lot of places, obviously. Now, these next two, I'm not expecting too much back pain because, well, to be honest, we're doing them because of leg symptoms. And he may or may not have pain in those areas. Let's find out. Are you comfy? How bad is that on a scale of 1 to 10? 10? Is that where you've gotten pain before? All right. But you've had it there in the past? Okay. That's funny that was a 10. So the 1 was a 7. Everything else is a 10 and concordant. We're almost done. We're going to put you to sleep in a minute. So are you ready to take a nap? All right. We're going to put you to sleep in just a second, okay? On a scale of 1 to 10, how bad is that? 10. All right, show us. Is that where you get pain?
Yes, I felt it on the left side of it.
Good for you. All right. Well, we're going to fix the left side another day, but today is just the right side. So, Jordan, go back up there and show us those herniations. So, folks, look at these 2 herniations. Henry, go to the x-ray. Look how they bulge out into the foramen where the nerves are. They're taking up room where the nerves are supposed to come out of those holes. That's why the nerves get pinched. People say, well, does your surgery fix spinal stenosis? Of course it does. Spinal stenosis is narrowing. And what causes the narrowing is mostly the herniation. You got to put them to sleep. When you wake up, that pain will all be gone. Any questions from the audience at this time?
No current questions.
All right, we got a little quagmire of needles to work through here, but we're gonna get through this. So we're starting with 5-1, Luis? Yes, sir. All right, so needle comes out, guide wire stays in. Try not to pull the other needles out, that's the rule. And now, folks, we're gonna bring the dilator. You see that, Henry?
Yes, we do.
Now, some of you may be wondering, does he have green or blue blood? The answer is he's got red and blue blood for our country. He's patriotic. Red, white, and blue. Jeez, are you kidding me? Take your time. I'll use lots of medicine. My anesthesiologist and I are just talking about the patient, coordinating, making sure to keep him safe and comfortable.
I also find it interesting that he has a cervical fusion.
Yeah.
He's uncomfortable from that, sir. He didn't want that in his lower back.
Well, yeah,
He has a cervical.
Dr. Berndes is talking about something here with me, and what he's saying is this patient had a fusion in his neck. So clearly he's got spine problems, right? And he had the cervical fusion, knew what it's all about. He regretted it because he said he hated having a fusion. And now he's here to get the laser surgery rather than another fusion. Okay, let's start driving this down. We're at the foramen. We're coming in underneath the nerve root, the L5 root, lateral to the S1. We're going to go nice and slow. I've used plenty of numbing medicine. We put numbing medicine even in the discogram material. The nice thing is, as I'm hammering the dilator in, some of you are going, my gosh, is that safe? The answer is yes, it's safe as long as you know what you're doing. Hold that. And thank God I've done this, how many times now? I've done this about 3,000 discs. 3,000. But 5-1 is the hardest. Now, the dilator is going in quite easily because there's a gigantic tear there. And whenever there's a big tear, well, the dilator goes in pretty easy. So that went in 5-1. See how we're working around these other needles? We've got two incisions, and we're working around the needles that are going into those two incisions.
He had a very strenuous job. He was working on mountainsides.
Let's not give any identifying info. But he is from California, right? Northern Cal? Most of you know I'm from Southern Cal. That's what we call it, Cal. I'm from Thousand Oaks, San Diego. I mean, originally Thousand Oaks. I went to, for those of you interested, I went to Thousand Oaks Baptist School for my elementary. And then I ended up at Lutheran High School of Ventura County for high school, obviously. And then UC San Diego, University of California, San Diego, undergrad, University of Southern California, USC, Los Angeles for medical school, and then University of Florida in Gainesville for neurosurgery. It's a long time to be in the school system. It's about as long as anybody can be in the school system, you know, and I don't regret it. All that I learned at those places has taught me a lot. It's allowed me to do what I do here at Duke Spine, pioneer new technologies for people to get better. Work with the best in the business, my team. All right, Henry,
Once again,
why don't you
no worries.
show us why do disc herniations cause so much back pain? Whoa, whoa, whoa. Pull? Yeah. Why do disc herniations cause so much back pain? Let me see. No, it's the opposite.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. And now you can see from our video why a herniated disc does cause so much back pain. The answer is inflammation inside the back wall, the annular tear, we call it, of the disc. That's what we're targeting right now. You see the blue stuff? This is the annular tear, that blue line right there. And I'm using my laser to clean up that tear. Now, sometimes we have to go in and grab out a chunk of herniation. But most of the time, the laser does a good job of releasing the herniation, just like you saw, and debriding the annular tear. People ask me all the time, Dr. Duke, but don't you damage the disc? How much of the disc can you take out? We're not taking the disc out, are we, Luis? Nope. We're taking out the herniation, which is not part of the disc, by the way. And we're debriding the annular tear. A debridement is something totally different than a discectomy. Discectomy is where you take the disc out. We're not doing a discectomy. We're doing an annular debridement. All right, any questions from our audience? There's the tear right there. You guys see it, the blue?
Yes, we do.
That is the tear. Look at the pink stuff right there. You see the pink?
Yes, we do.
I mean, what pretty colors we get to work with. Blue, pink, white, gold, calcium, bone spurs. So what's nice about this work is that, you know, if you think about it, I hate to say it this way, but I've never said it this way. We are not doing cosmetic surgery on the spine. That's Dr. Berndes saying. We're not doing cosmetic surgery on the spine, okay? We don't do spine surgery to make it look good. We do spine surgery to make it feel good. Now, that said, it would be kind of boring if you watch the same program on television all day, rerun after rerun. So it's kind of nice that everybody's disc is a little bit different, but also that it's kind of pretty to look at, okay? Some of you might think it's a bit weird to say, but you know, there's far worse things you could look at, like colons and rectums, prostates, other things I won't mention. So it's not too bad to have to look at a disc all day. Right, Luis? With that, I will open us up to questions. Any questions?
Yes, we have 2 questions so far. This first one comes from E. Alvarez on YouTube.
Hello, E. Alvarez on YouTube. Thanks for asking a question.
They ask, I just joined recently. What procedure are you performing?
What procedure are we doing?
Yes, they just joined recently.
This is called the Duke Laser Disc Repair. You are watching a new state-of-the-art spine surgery used to fix herniated discs without destroying the spine to do it. All the spine surgeries available today destroy the spine. If you do a laminectomy, it destroys the lamina, the facets, the ligaments, the muscles, creates scar tissue. If you do a microdiscectomy, you're destroying the facet, the lamina, the ligaments, the muscles, the soft tissues. If you do a fusion, you're destroying the joint, the disc. and the facets. If you do an artificial disc, you're destroying the disc. So all the surgeries today that you're familiar with are old surgeries or newer surgeries, but still old compared to this surgery. This is the least invasive, most advanced spine surgery in the world that actually works. And that's why people come from all over the world to have it done, because it really does work. That's why we do it at Duke Spine. We do it because it takes away people's back pain and that comes from the disc. We also have a treatment for facet pain. That's FACET pain. There's two primary causes of back pain, the disc and the facet joint. But they have to be injured, okay? Not normal discs. Normal discs don't cause back pain. And normal facet joints don't cause back pain. You must have a damaged disc with an annular tear, just like the one you saw in that video that we just played. If you have a tear in the back of your disc and you have a small herniation, it can cause really substantial back pain, even leg pain. And that's what we're fixing with this surgery, using a laser. The blue thing is the laser, okay? The blue is just plastic. But if you look at the tip, there's a glass thing. You see that glass right there? That's a 1 millimeter wide laser fiber. It's all FDA approved, okay? So we only use FDA approved equipment, supplies. This is FDA approved. And it delivers from a laser machine that we have over here by the patient's feet. There's a machine plugged into the wall that makes energy, laser energy. And we're using the laser energy to clean up this tear in the back of the disc that's causing so much pain for so many years for this patient. When we just tested this disc to see how much pain it causes, it was a 10 out of 10, the highest level you can possibly get. As a matter of fact, all of his discs that we're fixing today were 10 out of 10 except for one, which was a 7 out of 10. But the other 4 were 10 out of 10. So we're going to be getting rid of that back pain from his discs, that 10 out of 10 back pain. We're going to get rid of it permanently with this surgery. Now he does have other cause of back pain, which we're not fixing today. He has facet pain. That's spelled F-A-C-E-T, facet joint pain. And because we're already doing 5 discs, we can't do the facets at the same time. It's too much surgery for one day. So we decided we talked to the patient ahead of time and we said, it's too much to do in one day. We want to split it up in 2 days. He said, sure, go ahead. So he's coming back Thursday and we're going to do his facets, okay? But today is just the discs. And we're doing 5 of them. So it's going to take me 2 hours to do. He's not an easy case because he does have an airway that needs special attention. So our anesthesiologist will do that. Great question.
We have another question.
Sure.
Yes.
I'll take all your questions. So type them up. I'll do my best to answer them.
This next one comes from Elaine on Facebook.
Hello, Elaine.
They ask, do you do a foraminotomy? Some do, I thought.
Yes, I do a foraminotomy. We call it a foraminoplasty because it's not really a foraminotomy like you might think of, where you drill away the bones behind the nerve and open the foramen by removing the lamina, the facet, the ligaments, okay? That's kind of what people think about when they're talking about a foraminotomy. So we do a foraminoplasty where we're opening the foramen but by removing the herniated disc. See, there's 2 ways to open the foramen, in the front and in the back. Because the foramen is being narrowed from the front, we open the foramen from the front by doing the laser surgery. That's the best way to do a foraminotomy. Other doctors, like the ultrasonic doctor, he can't do the surgery to the front where it should be done, so he does it through the back, and he removes the bones in your back of your spine. It's a very bad procedure. I strongly recommend you don't do it. We could do it here at Duke Spine, but we don't do it because it's a bad surgery. Foraminotomies by themselves do not get rid of back pain. Foraminotomies can only help leg symptoms. Grabber. Just about done at L5-S1, then we're going to move on to L4-5. Keep the questions coming. Happy to answer them for you. Henry?
No, no current questions at the moment. Apologize.
All right. No problem. Let's do this. Let's run the video on how the Duke laser disc repair works so people can get that question answered.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. Now you understand what the Duke laser disc repair surgery is all about. We go in without destroying your body or spine. That's why there's no pain after the surgery. Patients take Tylenol for the most part, a muscle relaxer. And then we're basically debriding your tear in your disc. And by doing so, we're allowing your disc to heal for the first time, naturally heal, without metal or plastic being put in there. Okay, shot. We're now going to fix the next disc shot, which is of course the L4-5. Right, Luis? And then we're going to come back and do the L3-4. Shot. So I have to take this needle out carefully so I don't disrupt the other needles that are in the other discs, and I can place the guide wire and not accidentally pull it out. Now if you're doing this kind of surgery, shot, and you are accidentally pulling out the guide wire at any point or the needle, you must stop and restart. Shot? Is that where I am? Mm-hmm. Yeah. You must stop and restart and replace your needle. Because if you don't do that, then you're going to end up harming the patient. That's why, rather than stopping and restarting, I like to actually keep the needle and guide wire in where it's supposed to be, so I don't have to restart. Because that's never good when you have to restart. Shot. All right. We're now entering L4-5 on the patient's right side. This disc was a 10 out of 10. Take. Shot. Yeah. It's amazing this time, right now, I'm actually able to get into the disc easier. Like before, if you remember when I put the needle in, it was really hard because he was awake and his muscles were tight. And he was compressing down, and that was causing, Yeah, not now. We're not having that problem now. Now we're able to get an entire dilator in the disc space, whereas before we struggled with just the needle. Ready? you there? You good?
Yeah.
Good? We'll go a little more. I felt it going a little bit more. That should be good. Let's see where we are there. That should be good. So folks, we're now inside the L4-5 disc. And we may have cold welded. No, we're good? Very good. Perfect. Shot? Perfect. So you can see the tip of the tube. Show us the tip of the tube, Jordan, in the L4-5 disc. It's literally just at the inside of the annular tear. So we're going to start on the inside of the annular tear, inside of the herniation, and work our way backwards. As we pull out, pulling out, you like that? Sorry, just reminding me of high school for some reason. Anyway, as we pull out, we're going to be cleaning the tear and removing the herniation. Sorry for the metaphor there. Okay, you can see the herniation right there. See the pink tissue? Granulation tissue.
Yes, we do.
That is the source of pain right there, the inflammation we talked about. Now, they've already seen the DLDR one, right?
That and the back pain video, yeah.
Yeah. So they're totally knowledgeable experts at this point.
Exactly.
All right. Well, folks, we put this show on every single week. How many times, Henry? Too many to count, right?
Yeah, yeah. It can go range from 2 to 8 times a week.
My wife was upset with me last week, and I was asking her, she was upset, and I asked her at the wrong time. I said to her, how long have we been married? You know her response? Too long. Too long. You know you're in the doghouse when you ask your wife, how long have we been married? And her answer is too long. Normally she says 20 years, 21 years, whatever we are. But this time it was too long. She cracks me up. She's so damn funny. She doesn't even try to be. That's the thing about her. She's very witty. And put a smile on my face. All right, any questions from our audience?
No current questions.
All right, that means we're doing a good job teaching. So why do we broadcast our surgeries live for the world to see? These surgeries, folks, are live. If we make a mistake, you're going to see it. Doctors make mistakes all the time during surgery. Happens all the time. We don't. Why? Well, part of the reason why, to be honest with you, is these surgeries are pretty straightforward. It's kind of hard to make a mistake. Now, we can make mistakes, of course, so we're not going to get complacent about it, but compared to a fusion or an artificial disc where you're digging around in the abdomen of somebody, that's, well, gosh, there's a much higher chance of having a complication with those kinds of surgeries because they're far more complex. This surgery is pretty simple. Therefore, complications are unusual, but they can happen. Thank you. The point is, this is a surgery that's safe and very effective. You can see the testimonials, people who've had the surgery done. Those are all people, for the most part, that have come here, had the laser surgery done, and they're sharing their experience of how they're doing. You can see from the testimonials, we've been able to eliminate their back pain or leg pain from the areas that we're treating, the discs or the facets. Okay? So the surgery is effective. It doesn't have a high complication rate like other surgeries. And these are outpatient. So the patients literally are going to go home right after the surgery. They'll recover for 1 hour and then they go home. So we want everyone to see that their backs and necks can be fixed safely and effectively and with minimal recovery time. It's possible. Of course, it doesn't happen 100% of the time. Our success rate at getting rid of back pain is from the treatment is about 95% average. of elimination of back pain. That's on a average for patients. Some patients do better, some patients not as well as 95%, but the average is 95%. And at 6 years follow-up, the average was 92%. So it actually stayed about the same. There was no significant difference, if you look statistically, between the 95 and the 92% in 6 years of follow-up. That's durable. That means these results last. They're not just temporary, like so many treatments are temporary. These are durable with the Duke laser disc repair. All right, any questions?
We have 2 comments, and this first one
You guys see the tear there? Let me zap this right here, and you'll see the tear underneath. You guys see it underneath right there?
Yes, we do.
Go ahead.
This first comment comes from Dr. Berndes on
way.
Facebook, and he says, "Hey Henry, great job."
Oh, that's so sweet. I love it. Yeah, Henry, he's right. You're doing a great job. Thank you.
I appreciate you, everybody. Thank you. And then we have another comment that comes from E. Alvarez once more on YouTube. And they said, "Thank you for the clear description of this procedure. The videos are very helpful as well. I will be submitting my MRIs for your review. I've been unable to work for 5 months due to pain."
So sorry to hear that. So sorry to hear that. And you know what? Our goal here at Duke Spine is that no human being live in pain. That is our goal. We are set, huh? Life is short. And you know, the sad thing is that so many doctors are telling patients you've got to live with pain. There's no way to fix it. But they're wrong. That was true 20 years ago. It's not true today. Okay? We can fix pain in the back, pain in the knee, pain in the neck, pain in the hips, pain, most pain we can fix, okay? There are a couple of pains we can't. And we'll know based on the MRI review if we can fix your pain. So I think it's a great idea, and I'm looking forward to meeting you face to face and reviewing your MRI and doing an exam. One thing I'd like to point out is that everybody thinks the MRI tells the doctor where the pain comes from. It doesn't. Only the patient can tell the doctor where the pain comes from. MRIs do not. MRIs do not. Wow, look at this tear here. It is bad. This is the L4-5, so grungy. Lots of scar tissue. That's the white stuff. See the gold color? Calcium, dystrophic calcification, abnormal calcium. Shouldn't be there. Your body puts calcium in tissues that are hurt, that are damaged, that are torn, mostly through inflammation. So basically where there's damaged tissues, there's inflammation. Where there's inflammation, there's pain and swelling. When there's chronic inflammation going on for years, you get calcium deposits and bone spurs. That's what we're seeing, folks. Nothing we can't fix. All right, as we've said many times before, we have done over 1,600 of these endoscopic laser surgeries, and pretty soon we're going to be at 1,700. Grabber. The laser is used to do the debridement, but we do also need grabbers to try to pull out big chunks of herniation when we can. Sometimes we get lucky, we get the whole thing coming out with the grabber, and then the surgery is shorter, more efficient, but most of the time we've got to take these herniations out a little bit at a time. Right now we're getting a couple of nice pieces coming out. Every one of these blue things is a piece of herniation that's stuck in the back of the disc and the tear, and we're able to remove them. I'm reaching across towards the midline here, middle of the disc. Usually with this surgery I can get to the middle of the disc. It's really hard to get to the opposite side. I would say you cannot,
Right?
not through this approach. So we tell people that if they need both sides done, they're going to have the other side treated independently in a separate procedure. Or the same procedure, but we'd have to go to the other side. Laser?
We have a question.
I'll take the question.
This comes from Dominic on YouTube.
Hello, Dominic on YouTube. Welcome.
They ask, it looks very invasive. Wouldn't there be a huge hole in the disc annulus after the surgery for the liquid nucleus to leak through or leak out again?
Dominic, great question. I love that question. So Dominic, you see a tube in the disc, right? What you don't understand yet, which I'll explain it to you, is that this tube is sitting inside the herniation. In other words, the herniation was here. We went into the herniation through the disc. So we didn't go through the normal part of your disc, we went through your herniation. So there is already a hole here. You're correct, there's a giant hole right here. But it's a hole that was made by your herniation, not by us. We're just taking advantage of the fact that it's here and going through it to fix your disc. It's brilliant. It wasn't my idea. It was actually Dr. Anthony Young's idea, Dr. Tony Young. He was the founder of the Desert Institute for Spinal Care, or DISC, out of Phoenix. He was one of my mentors early on. He calls it the inside-out technique, and it's his baby. It's where he would go in through the tear, I got it, and literally repair the herniation, starting with going through the herniation into the disc. So you're correct, when we're done there's going to be a hole, but that hole was created by the herniation, not by us. We're just cleaning the hole. That was my addition, to do a debridement of that tear. That's why it's called the Duke Laser Disc Repair. Great question, great observation. Thanks for pointing that out. Now, the one thing you'll see too is that the hole where the herniation came out, it's about 7 millimeters, about the width of the tube. When I'm done, it'll collapse down to probably about 4 millimeters. You'll see. So by cleaning out the herniation here, we're actually improving the tear. We're starting the sealing process. Those right there, fibers, are foraminal ligament within the foramen. There's calcium deposits in there. I need 1 minute, we'll be done with this disc, we'll move on to the next. How's our patient, doctor? Got him on the CPAP?
Yeah, I was just checking our first case into the toes. Thank you, sir.
Good.
Still sleepy? Okay. He has a history of being a little sensitive.
No problem. No prob. All right, there's the end of the herniation. Right there. Huh?
No discomfort at all.
Good, thanks. Good to know. So our first patient, the laser cervical patient from Idaho. Thank you. He's doing phenomenal, getting ready to go, leave our Duke Spine facility and head back to his hotel. This is the very back of the herniation, folks, and what you're seeing there, that red stuff at 12 o'clock, that's fat and blood vessels sitting in the what's called the epidural space. And that blood vessel is a vein. It's called Batson's plexus, B-A-T-S-O-N-S, Batson's plexus. The pink thing to the right over there, that smooth thing, is the end plate. It's the end plate of the vertebral body. It's basically the bone where the disc is wedged between. There's one on the left, one on the right. And you can see the tear here in the annulus. So basically the herniation is between the bony surfaces, or end plates. The end plates here look a little red. You guys notice that? Compared to the typical pale white, whitish pink. They're a little more reddish. That's because there's inflammation in this disc, lots of it. And that's what we're here to fix. Grab her. Just about done. I'm biting laterally there to the side, to the outside, to the flank. If you do endoscopic surgery, especially, lumbar transforaminal like I'm doing, you want to make sure you bite laterally with your grabbers and use your laser laterally inside the disc, and the reason is that there's lateral herniation, and a lot of surgeons will miss it, and it's the number one reason patients still have problems after spine surgery. We're done. So let's see if we can see the nerve. The nerve is going to be right up there. It's kind of hard. It's inside that. There's a little bit of fat there. Let me get a little bit of that herniation just below the nerve cleaned up. Right? All right, all done. Beautiful. Great job. That's it. All right. Well, I'm happy with that. That's the facet joint right there at 12 o'clock. For those of you wondering, remember behind the disc is the nerve and then the facet. We've pushed the nerve out of the way, and now you're looking at the facet, the anterior surface of the facet. We don't need to do anything with it, but you could drill it if you want to give more room. If I did, that would be a foraminoplasty, okay? More of a foraminoplasty than I've already done. Right now I'm putting antiseptic, and we're just irrigating out with some betadine and then some saline to clean out the area that we operated so that there's no blood products and stuff. That way you minimize the risk of infection. All right, questions from our audience?
No current questions, but we do have a comment from Sunil on Facebook.
All right, Sunil, bring it.
They said, nice doctors and care team. I had surgery back in January and fees great. Amazing, Dr. Duke. God bless him.
Sunil, Dr. Berndes is so happy for you. He's clapping. We're all happy. It's so good to hear from one of our patients. I'm so happy you're doing well. Congratulations, my friend. Thanks for checking in with us. All right. Well, we are almost we're pretty much halfway done because the discogram took some time. We're going to do the next disc, which is number 3-4. We're going to place the guide wire down the needle into the disc, use the x-ray to verify. You can see it there. Perfect. Now remember, this disc is very degenerated. Remember, we had trouble getting in. Okay? Ray? Ray text. So now that the patient's more relaxed, we should be able to get this dilator in. Once again, we will use numbing medicine through the dilator. You can see on the side of the dilator there's a port that allows me to inject medicine. Shot? Yeah, we're really close to the foramen, so I just have to be careful. Shot? If you inject numbing medicine right where the nerve is, then you're going to numb the nerve. The patient might wake up from surgery and have weakness in their foot or numbness in their foot, which we don't want, but in the end, it's important to keep the patient comfortable. Wow. All right, we're starting to open the disc. You guys see that? The white thing?
Yes, we do.
Yeah, that is the disc opening as the dilator goes in. Shot? Yeah, you see that? We call that vacuum space phenomenon. It's basically a space, airspace. That's why it's so white on the x-ray. That means the disc is very collapsed. This is as collapsed as a disc can get. I get a lot of questions from people. Hey, Dr. Duke, I've got a collapsed disc. Will your, degenerative disc disease? I have no more disc. Will your surgery work? The answer is absolutely it will work, because the collapsed disc is not your problem. The problem is the annular tear. Once again, what we showed you in the video, it's a small tear in the back of the disc that gets inflammation. And that's where your pain's coming from. Even when you have scoliosis, even when you have kyphosis, listhesis, degeneration, and stenosis. It's always coming from the annular tear. That's what we discovered at Duke Spine Institute. We've been telling people, but it's really hard to get the message out. Doctors just want to do fusions and artificial discs and laminectomies, dangerous, destructive surgeries. But they're not treating the source of the pain. That's why people still have problems after surgeries. Okay, there it is, degenerative disc. Little bit of disc material, the blue stuff, herniated nucleus. There's, I'm going to pull that out. It's very calcified. It won't even come out through the scope. I had to take it out otherwise. Some really degenerated cartilage there from the end plate. Look at this piece of herniation here. You can barely see it on the grabber, but it's totally scarred in. All calcified. It's on your knuckle. All right. Coming in with the laser because the grabber is not doing anything. So the shortcoming of surgical instruments that are made from metal is they have a limited ability to do their job. Are we getting close on the irrigation? Because I'm starting to see bubbles. Really? Huh. All right. These are pieces of herniation coming out. Or not coming out. All right, any questions?
No current questions, but we do have a comment from Canes25 on YouTube.
Okay.
And they said, can't wait for your Netflix show to drop. Gonna make it go super viral. Keep exposing the truth, doctor. You are the best at it. I learned so much more from you than any other spine surgery.
Ah, thank you, my friend. Yeah, so thanks for the mention. Yes, I talked to the director / producer, and he believes that we can have it completed in 1 year. And
Should I go get a haircut?
why a haircut? Oh, you want to look good? Right. So the Netflix show is going to use real actors and actresses, and it will not be using me. I mean, I might have an appearance where I talk, but it's going to be a docudrama, they call it, where you are talking about a real issue, but with real actors, so that you guys wouldn't have to suffer through an hour of me, my face and my voice, which my wife.
I should submit my resume. I was on that Lifetime channel.
Yeah? All right. Sure. Well, I mean, we can certainly talk to the director. But he believes, the director believes, that what we're talking about is going to be so interesting to people that there will be more than one movie. And eventually he thinks there's a strong likelihood of having a real motion picture about it. But the way he described it to me is we need to start with baby steps and gauge what the level of interest is in the subject matter. Hence, that's why we're doing a docudrama that's focused on basically all the problems we're seeing in the spine world, with respect to mostly implants and fusions being done unnecessarily. So that's going to be one of the main parts of the movie. I appreciate you saying that. I still have to put together the budget. And if you know of anybody who wants to support the movie, let me know. But it isn't cheap to make a movie, as you can imagine. It's not like we're making Avatar, but it's not cheap. So, but I appreciate your sentiment. And I sure hope that people will watch it when it's made. Not because I want to make money off of it, but because I want people to be aware of what's happening to them, what's going on, the truth. So, of course, we're going to be looking for some interviews of real patients or real healthcare providers in this section, and talking about real patients' experiences. It's going to be real, basically, real life docudrama. So I'm going to have people who've had spine fusions and surgeries done that want to share their experience, create their stories, and put them in the movie. Not all of them, but as many as we can in the time we have. So for those of you watching, I know many of you have been cut on and harmed unnecessarily, and some of you may want to share once we go into production and we can interview you. Just let me know in the future. Thanks. All right. And Dr. Berndes has already volunteered for the
We did our lifetime work. We had cameras follow us the
Your-
whole day. The day of bariatric surgery, taking care of, I think 7 cases.
really
And they spent the whole day with us. One of our cases was very, very famous.
nice.
Then they followed his life before the surgery, during, and then they followed him 1 year after.
And what kind of viewership did you get?
Bariatric surgery, it was all kinds of surgery. We had a lot of surgery.
Do you remember
It was on Lifetime.
how many people watched it?
No, I don't know.
Apparently Netflix cares.
Lifetime paid for it all.
Really?
Yep.
I'm having to pay for it. So, all right. Any questions?
Real life documentary. They followed us.
No, I know. Mine is more of a pilot to see, to gauge interest, and once it's been determined that this is an important topic, which I know it's important. Once we've shown that people are wanting to hear about it, there'll be more. That I won't have to pay for, hopefully. But the first one, I've got to fund as the executive producer. The person who has to make sure it's paid for. Anyway, questions?
Ours was about the famous actor for Buck Rogers.
We have
For
a question.
Buck Rogers?
Yes.
What are you talking about?
So,
Hold on a second.
so,
I got to
Got
get
it.
the juice here on Buck Rogers.
so ours was basically following the star of Buck Rogers.
The star of Buck Rogers, the guy,
Gil Gerard.
he got heavy?
Really? Yeah.
Really?
So we did anesthesia. They
Oh
brought
my
cameras
God.
into the room. They did even everything.
I had
They
no
did
idea.
my induction.
Wow.
He's evaluating him in the pre-op area, pre-op labs.
Yeah, that's awesome.
Yeah, they filmed everything.
Buck Rogers in the 21st century.
It was such a really nice patient to work with. Good, super happy with the result.
I can't believe it. I used to watch that
He
program.
lost over 100 pounds.
100 pounds, that's awesome. We're just talking about a documentary that Dr. Berndes was involved in back in Vegas, right?
Yep.
With, I guess, the main actor for Buck Rogers, which is like a 1980s series, right?
He still has a huge following. He was telling me. Like he goes to the Comic-Cons and
I had no idea, that he had to battle that problem with weight. All right.
I went to dinner with him.
Nice.
It went all the way out to,
There's the nerve covered by some veins. And we're done here. But let's take the question. I'll get back to you with the Buck Rogers stuff. What's the question?
This question comes from Bali on Facebook. And
All right, Ali on Facebook.
they asked, hello, doctor. Nice work. My question is that does the laser repair treat all aspects of the disc issue? For example, if a disc is severely dehydrated, large prostration, annular tear, borne spores, etc. Also, what treatments do you have for pain, the cheek, but when walking, sharp pain?
Okay, well, let me try to answer all your questions. First of all, the laser surgery does not fix all the structural abnormalities that you see on a disc. It doesn't fix the collapsed disc, the degenerated disc. It doesn't fix the scoliosis, listhesis, but you don't need to fix any of those things. That's the whole point. That's why we show you these surgeries. Those things are not causing any problem for the patient. Yes, they have a degenerated disc, so what? There's millions and millions of people with degenerated discs that have zero back pain, zero leg pain, no problem at all. They're normal. They run, they jump, they hike, they water ski, they paraglide, whatever they do everything normal with degenerated discs. So you have been duped, lied to, tricked, chicaned to believe that degenerated disc needs surgery. It doesn't. What needs treatment is pain and loss of function because of pain or neurological deficit. We call that instability. That's what needs treatment. And the instability can be fixed with the laser surgery. Because the laser surgery you're watching right now will eliminate back pain and neurological compromise through decompressing the nerve root and treating the annular tear, irrespectively. The second question you had something to do with pain with walking. Was it Henry or this is clogged?
I think I said it. I can't remember.
You said some kind of pain with walking or something.
Oh yes, yes. Apologize. He said,
John.
what treatments do you have for pain for the cheek, but when walking, sharp pain?
Sharp pain in the butt cheek?
I think so. I think that's what
Oh,
they're.
that's called piriformis syndrome.
Okay.
Spell it for him, Piriformis. You probably have piriformis syndrome. That causes sharp pain in the butt cheek with walking. That requires an injection of the piriformis muscle and some piriformis stretches. Tiki.
I got it.
All right. Remember, this patient's had 37 years of back pain. 37. Almost 40 years. And it's coming from these spine injury, these bad discs and bad facets. And we're going to fix the disc today on the right side. We're going to fix the facets on Thursday. It's trapped. Oops, sorry. Yeah, it's trapped. Sorry. See if we can get it out. All right. That looks good. We have the L3-4 and, the L2-3 and then the L1-2. 2 more discs to go.
We have another question.
Yes.
This comes from Dominic, once more on YouTube.
Yes, Dominic.
They said, thanks for your answer. I just don't understand how it will help because there will be a hole in the annulus that can fill with the nucleus again right after surgery, right? Or there will be no nucleus left?
Yeah, Dominic, great question. So you're right. There's a hole in the annulus still there that needs to close. It will take 1 year to fully close. So how do you prevent the nucleus from going through the hole? Well, the nucleus is not water. It's hard, it's solid. It's only going to go through the hole if you push it through the hole. And the way you push it through the hole is by doing heavy lifting, squeezing on your discs with heavy weights, or bending forward and picking things up from the ground. That's how you push the nucleus through the hole. If you don't do heavy lifting, if you only lift 40 pounds or less, and you don't do contact sports for 1 year, you will not push the nucleus through the hole. How do I know? I've been doing it 16 years. I have thousands of patients I've done the surgery on, and they don't re-herniate, as long as they follow the lifting and bending instructions. So great thought, except you can clearly see the nucleus, the blue stuff, is not liquid. It's solid. So the only way it's going to go through that hole is if you push it through the hole, through what you do, your activities. That's why. I'm glad you asked. I'm sure if you didn't understand it, lots of people don't understand it. But the nucleus is not water. It's solid. Remember, matter has, well, 3 states, maybe 4. Solid, liquid, gas, right? You all learned this in high school, elementary school. There's also plasma, which is another state of matter. And God knows how many other states of matter there are now. There's dark matter and other things that we've come to learn. But if you just stay basic, solid, liquid, gas, the disc jelly is a solid. The annulus is a solid. Water is a liquid. Kool-Aid is a liquid. But the disc material is never a liquid. It's a solid. So it will not escape unless you give it reason to leave, which is pressure. Pressure would cause it to leave. Pressure comes with lifting, twisting, bending, carrying heavy things, picking up furniture, going to the gym and lifting weights, playing football, rugby, jiu-jitsu. Those types of activities put pressure on the disc and cause it to herniate. Without those activities, it will not herniate. So my patients restrict their activity for the first year. I tell them to. And by doing so, they reduce the likelihood of reherniation. The people that have reherniated, they always tell me they were lifting something, bending, picking something up, and they felt a pop in their back, a pop. What that pop is the annulus tearing and the herniation popping out, a new one. So it's very rare. It happens in 1% of our patients. 1 out of every 100 will have a reherniation. But if they follow my instructions, they don't reherniate. By the way, the concept of going through the tear where the herniation is not new to me or Dr. Young. That's standard for microdiscectomy. If you're getting a microdiscectomy, the surgeon is going to remove your bones and ligaments from the back of your spine. Then, when they find the disc herniation right here, they're going to go through that tear. See the pink stuff? And they're going to grab with the grabber and pull. So they're going to go through the tear too. When you do a microdiscectomy, there's a giant tear still there, and it's not clean, it's dirty. So that's why it reherniates, because it never heals. The only way to get this tear to heal is to clean it with a laser. Duke laser disc repair. This surgery done at Duke Spine is the only surgery in the world that removes the herniation from the tear and cleans the tear so that it can heal. That's why we broadcast our surgery, so you could see it. You can learn the truth, because the other surgeons won't tell you the truth. They don't know how to do the surgery. They're not capable. Is he moving? Or is that you?
Looks like he's free still to me.
Yeah, no, he was moving, but it was Luis moving him. It's a fine. I just was wondering how light he was, that's all.
Luis is like,
No, Luis is doing his job, jumping around, doing his dance. What kind of dance, Luis? Salsa? A little salsa dancing. And his partner is moving, you know, with him.
We can do salsa teaching after the surgery. The video for Netflix.
There you go. My ultimate goal is going to be to do a live, what do you call it, reality TV show. But you do?
for your Netflix.
You, oh right, no, we have, but a reality TV show would be cool. Then you can literally tune in and follow someone's experience as they go through the entire process, you know?
That's how we did it on Netflix.
Yeah, but I'm talking about, you did it with one. I'm talking about every single day. Every single day. My God, just the experiences that people will share. I mean, this disease.
Go to the residents of the people that are coming to visit.
Absolutely, we're going to go to the residents. Their lives are going to be shown how bad they are, how they're dependent on pain pills, or how they're incapacitated. They're just sitting around on the couch. They struggle at work. They struggle with their relationships with people.
Number one cause of missed days of work.
Lower back pain. No, it's a huge story, and the word needs to get out, and people need to know, and that's only going to happen through media, social media of some type. I recognize that. Of course, there's word of mouth, which is great, but it's just too slow. Too many people suffering needlessly out there. All right. Oh, I like that. Diners, drive-in, dives, and dine. What is it?
Lasers, rhizotomies, and healing.
I like it. What is his name? Guy
Fiore, yeah.
Fiore. I like him. He's
I like
awesome.
that show when he drives around.
Yeah, he's good.
But that's basically the essence of a docudrama or series. They follow him every day. You know, he goes to a different place, right?
Yeah.
Meets the owners, meets the patrons, right? Takes all food.
No, it's the idea. You're right. Except I won't be driving around. I'll be
Here in the office.
in our clinic waiting for people to come. All right, just about done. You guys see that right there?
Yes, we do.
Yeah. At 12 o'clock is a vein. One of the veins we talked about earlier, down at L1-S1, Batson. This is all herniated disc and scar tissue. Blue is herniated, degenerated nucleus pulposus. The white is scar tissue. Within the annulus, the gold there is calcium. So,
We have a couple of questions.
yeah, I'll take the question.
This next
Just about done. I got 1 minute left on this disc, and then we're going to move on to our last one. But go ahead.
This next one comes from Bali, once more on Facebook. And they said, does the injection for the piriformis syndrome, how long is that effective for? And does it need to be repeated after for so long?
Yeah, great question. So the treatment for the piriformis syndrome, which is the sharp pain in the buttock, it's a torn muscle. The treatment is number one, stop tearing the muscle, let it heal. You need a physical therapist to guide you. on that. Okay, number 2, stretching, gently stretching and reconditioning the muscle to let it heal. So a lot of it's therapy. But the shot will make it feel better right away. It'll reduce the inflammation. You want to cut out the inflammation, okay? It's kind of like a fire, wildfire in California. You want to put the fire out, okay? And then, of course, things will start to grow back later on. But you got to put the fire out. If you don't put the fire out, then there's just more and more damage and destruction. So step 1, put the fire out. That's the shot with steroid. You may need to do 2 shots, 3 shots, 4 shots. Sometimes you have to do PRP, stem cells. Sometimes we have to go in and cut the muscle completely with a scalpel, okay? But you start with 1 shot, obviously, and then you see where it goes from there, okay? You got to do the therapy. You got to avoid injuring the muscle, okay? That's what you do. That's how you fix piriformis. If it keeps coming back, then you do surgery to cut the muscle. And that's usually an orthopedic surgeon who will do that. Actually, we're hiring one. I just realized, right? We're hiring an orthopedic. He's going to be able to do piriformis. Huh, nice. Okay, well, this is, let me just get that last bit right there. This is underneath the nerve root, way underneath it, exiting the foramen. This is actually extraforaminal almost right here. I just want to make sure I get it. Will you make sure Tabitha cooks me up another pot of coffee?
It's already prepped.
Oh my gosh, I love you guys.
Nice on, please.
All right, through 4 down, 1 to go. Oh, my back is starting to hurt. Getting old. Getting too old. Gonna have to build some kind of a fake spine. Goes on the outside. Like, what was that?
Yeah,
Is that Batman that has an exoskeleton? Was it Batman that had the exoskeleton? Who had the
Spider-Man.
Spider-Man. That's right. I need a Spidey exoskeleton. All right, you must have other questions, my friend.
Not from Bali, but we do have another question from Dominique on YouTube once more.
Dominique.
And they said, thank you for the answers, but what about sitting? Will it push the nucleus out? For me, it worsens the condition more than lifting and carrying things. Is that enough to push it out? Isn't that enough to push it out?
Sitting is not enough to reherniate. That's a great question because sitting does put 2.5 times the pressure on the disc than standing. But we've never had a problem with people sitting. So it takes more than that to push out more herniation. Great question. So you can still sit after your surgery and not have any problem. Remember, folks, we're not doing this surgery for the first time. This is 16 years of this same surgery we've been doing in over 1,600 patients. So we've seen it all, we've done it all, and the reality is that as long as you don't bend over and pick things up from the ground for 3 months, as long as you keep your lifting under 40 pounds the first year, and you don't do contact sports like jiu-jitsu or rugby, football, your first year, is that it? Then you're gonna be fine. You're not gonna have a reherniation, okay? But any kind of bending at your waist has to be avoided for 3 months completely. After 3 months, you can start doing some gentle waist bends. By the way, this hammering, a lot of people freak out. But what happens when I'm doing right now is I'm going through the herniation, I'm pushing it back into the disc. So this staking, metal staking, may actually be partially therapeutic right?
The last one, right? Last one.
Oh my gosh, are you guys freaking out about it? Yes, last one. I'm just starting to warm up and enjoy it. Come on. Let's do more.
We got a couple more coming up though.
Let's
Day's
do the
not
other
over,
side.
day is young.
The day is young. I like that. All right. Well, not bad. I think it took us 2 hours, right, for the whole thing. It's long, but not the end of the world.
How many DPRs do you have?
Next week or Thursday, we're doing bilateral 3, 4, 4, 5, 5, 1, and then cervical.
Sound a lot.
Yep.
There's no level laser involved?
What? Oh, yeah, you're right.
Yeah.
And there is a left 4, 5.
Yeah.
All right. Great questions. Ask away. This is our last disc we're doing, number 1, 2.
No current questions, but we do have a few comments from Canes25 going back from the movie. They said, make sure Louise is in the movie. We love you, Louise. And I'm up for a cameo, especially how much they cut into me. No doubt you will get the views and support. There are millions of us suffering and dealing with spine issues. You will captivate millions, I am certain. What you have taught me is focus on the symptom and let the doc focus on the anatomy.
What? I didn't hear that last part about anatomy.
What you have taught me is focus on the symptom and let the doctor focus on the anatomy.
All right.
And that's all.
I like the advice. By the way, since you mentioned make the millions, I want you to know I've already committed. If we do make money on these movies, I'm going to set up a foundation, and I'm going to put the money into a foundation that's called, we used to have a Duke Spine Foundation for research, but now we're going to have a Duke Spine Foundation to help indigent people who don't have the money or insurance to get laser surgery done. And that's what we're going to do. There's a lot of people out there that can't afford the surgery, don't have coverage, and they're condemned to live in pain unless somebody helps them. So yeah, we're definitely going to be helping those people. So I'm looking forward to doing a lot of good with that movie and the ones that follow. We'll let you know once we get underway. Supposed to have a meeting with the director, producer this Friday and go over some final details. We have a contract and then I've got to fund it. Bad thing is I haven't told my wife yet. I haven't figured out how to break the news to her. She's, I'm always the accelerator and she's the brake. She's the CFO. She knows how much money we have in the bank for this. So I've got to somehow just kind of siphon it out slowly. Let's just face it, I've had some ideas that haven't worked out so well, but and she makes me keenly aware of those. I mean, after all, isn't that what wives are for? Put us in our place, right? Every time I have a great idea, I run to her and I say, oh my gosh, I know how to cure the corals from their disease and save the coral reefs. And then I run some more experiments and the corals all die. And then she says, remember that time you woke me up at 2 in the morning from your lab doing research on corals to tell me you found the cure to the corals dying, only to tell me 2 days later the corals died after your treatment? She's right. How many times did I think I cured those corals when in fact they just died from the treatment? Of course I did cure them, but they were dead. That's the only problem. But they weren't cured because they were dead. They were cured and then they were dead. So I've just got to figure out how to cure them and not kill them. That's my next focus of research. I need to build my coral lab back. It's been too long. Henry, we got any more questions? We got about 5 minutes left here. That's the good news. And the patient's doing phenomenally well, considering he's not an easy anesthesia case.
As of now, no current questions. If any comes up, I'll let you know. All
right. So, folks, if you have questions, type them up. Happy to do my best to answer them. Our next case is a patient from the Cook Islands, down by Australia. And he is having his back fixed, correct? With the Duke laser disc repair and the DPR? And, I'm sorry? Combo. He's getting the Duke special. That said, after him, we've got one more patient from Texas with a few discs, 3 discs, I think, plus the facets, right? Yes, sir. So we still have plenty of action ahead of you all for the day. We're just about done here. This patient has done very well, and I'm pleased with the results with the laser here, and hopefully he'll do fantastic. It's if you have questions, type them up, and I'll be happy to do my best to answer them. I'm going to be coming out of here in about 2 minutes, maybe 5 minutes. I'm just looking at what we got left here. We're just at the back of the disc where the tear is, and you can see that's a piece of herniation. Remember we kind of shoved the herniation back in? That's one of those pieces right there. Okay, there's a few of them. I'm going to try to grab them and pull them out. There's one. So, you know, this whole inside out technique by Dr. Anthony Young, my professor and teacher. Excuse me.
Bless you. Bless you.
Thanks. His inside out technique is really incredible. I'm so fortunate that I learned it from him, because other endoscopic surgeons, they don't do it. And if I had learned from them instead, I could have had some very bad results along the way, and maybe not been as much of an advocate for this surgery. So there's definitely different ways to do laser spine surgery. There's definitely different ways to do endoscopic lumbar surgery, you know? And I like to think at Duke Spine we've figured out the best way, because we honestly get really good results, and our patients are generally very happy. 95% pain relief, 92% long term. That's pretty darn good. You won't find that with any other surgery. All right, type up your questions. Henry, you want to queue up one of our patients who's had the surgery done in the past?
Copy that.
And I'm going to be coming out in just a minute. Gosh, that one piece of disc right there is driving me crazy. area is like sticking his tongue out at me,
Understood. Copy that.
and I can't take that and do nothing. Right, Oscar? You know? Huh?
In the meantime, we do have a question if we want to answer it now.
No,
This-
no.
No. Okay.
I want to do it face to face.
Copy that. No problem.
But I'm literally going to grab this and we're going to be done. Just need you to wipe for me, Luis. Problem is it's not grabbing it because there's stuff inside the mouth of the grabber. How are we doing on irrigation? All right, yeah, I'm just about done. Fernandez should be a minute. Anyway, these are the discs that weren't causing him as much daily back pain, but they were still causing him daily back pain. He was just basically restricting his activity so that he wouldn't set these guys off. That should be it. Let me go one more grab and we're done. All right, good. We got it. Let me just trying to get it out. That's the piece I've been waiting for. All done.
Let's go off like one piece, thank you.
And then, like I said, I'll come talk to you guys face to face. Just a little antiseptic. All right. You guys want to see the incisions? There's two of them. You guys see this?
Yes, we do.
All right, now the incisions are about 8 millimeters. You guys see that?
Yes, we do.
And had we done an alternative surgery, a fusion, if I fused all five of those discs, that's how big the incision would be. This big. As big as a foot. 12 inches. And he would be in pain for months, taking painkillers for months. Scar tissue, muscle damage, complications, infection, all that stuff can happen. But with laser surgery, 2 tiny little cuts, and it's outpatient. He'll be gone in an hour and a half. Back to driving and walking and shopping and eating tomorrow. Back to normal. Okay? But he'll be back Thursday for another surgery. Type up your questions and I'll come answer them for you. Thank you. I'm going to call EBL 3 mil. DLDR. This was a right. Right. L1-2, 2-3. Go ahead, Henry. Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Duke laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah, yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do? Because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Duke Majan, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
And good morning. I'm Dr. Ara Duke Majan here with one of my patients who traveled from Hawaii, the beautiful islands of Hawaii, to Duke Spine Institute. You just had surgery for your back yesterday. How do you feel?
I feel surprisingly really good. Almost like nothing happened yesterday.
Yeah?
Yeah.
All right. Well, you came here with a lot of back pain. Is that back pain still there?
Yeah, 7 years back pain. One spot in particular, my right side, that pain's been there forever. A lot of pinching, hard to do things, and it's gone.
That is awesome. So what kind of things, you said hard to do things, what kind of things were you limited with your back pain? What did it keep you from doing?
10 push-ups, I'd be sore for a day. 20 push-ups, I'd be sore for 2 days. General work around the house, anything that was active I used to do, I just completely stopped. Stopped yoga, stopped surfing, stopped working out, stopped biking. I could swim a little, but other than that, I just was debilitated, depressed. Yeah, felt pretty hopeless too.
And you had prior surgery, and that didn't work too well for you.
3 years ago, in 2019, I had surgery and I never got relief. Never got relief.
You had a microdiscectomy, right?
I had a microdiscectomy. It was about a 7-month recovery. Couldn't get out of bed for about a week. Staples in my back, and it just didn't relieve any of the pain.
Yeah.
It was always still there.
And they don't. That's why we don't recommend them. And so, how is the Duke laser disc repair surgery? You could see in your video that we brought the laser in through a tiny incision. It was just 7 millimeters. And we used the laser to clean out the tears and inflammatory tissue. You could see some inflammatory tissue, the red stuff, pink stuff there. That's where the pain was coming from in your disc. We cleaned it out, and we also did the Duke plasma rhizotomy for you. And how do you compare the surgery you had yesterday at Duke Spine Institute with what you had before with the microdiscectomy?
Night and day. It went from like this giant kind of hospital procedure that just lasted for, it was just it's hard, you know, it just took forever from start to finish to getting approval to getting, you know, getting in there. Whereas here, I flew in the day before, did a pre-op, came in for surgery. I was out of here by noon. I think I was out of here by noon. I'm here the next day. Today's the next day, and I feel surprisingly really, really good.
When did you start getting up walking after your surgery we did yesterday?
I think I made a couple silly jokes, if I'm not mistaken, to the nurses, and then once the medicine kind of wore off, I was walking, not sure, probably within the hour.
Yeah, within an hour you were walking around.
Yeah.
And you probably walked at your hotel in the evening after your surgery.
Absolutely.
Yeah, because it was a tiny 7mm incision, that's all. No damage to your body inside. Anything you want to tell us about what your plans are now going forward, now that your pain's gone?
Well, the healing procedure still, the recovery procedure still takes some time. You got to be careful with your body, know your body. You know, I have directions from you on exactly what to do. It's just, you know, 7 years of I almost feel like an expert in the industry of trying to figure out how to fix things. And in one day, I feel more relief than I've felt in years. And you know, what I would say was, you know, maybe at least you do free MRIs, don't you?
Free MRI review, yep.
At
We
least
do that online.
let the team take a look and let the doctor take a look at your back or your neck, whatever it is that's ailing you.
Yeah, and you traveled, it's a long trip from Hawaii to Florida. How long of a trip is that?
It took me about 18 hours to get here. Layover in LA, layover in Atlanta. That actually was hurting my back. Sitting, you know, that's a tough road, so, or tough flight, but worth it, worth every penny.
Anything else you want to tell your fans out there?
The only thing I would say is just pick up the phone. I would say at least take a look, because, you know, he does amazing things, and if you get on his YouTube channel, you'll see all the testimonials of what got me to do it. And
Hundreds of testimonials.
Hundreds, yeah, of testimonials. So. That's
And
all
we
I would say.
broadcast our surgeries live so everyone can watch it. So
I already watched my surgery. I posted it on Instagram. But thank you, doctor.
Congratulations.
Yeah, thank you very much.
Yeah, it's my pleasure.
Yeah.
All right. Let's get you home.
All right.
How long are you in Florida for? Good morning, it's February 22nd, 2023. I'm Dr. Duke Mage, and I'm here with one of my patients who traveled to Duke Spine Institute, not too far away from Jacksonville.
That's correct.
Yep.
That's where we're from.
You found out about Duke Spine through the internet,
Yes, I did.
and why did you end up coming here?
I ended up coming here because I could not get rid of the pain that I had in my back and in my leg. I tried to exercise, I tried every physical therapy, yoga, everything you could think of, and I just could not get out of it. It just would linger and linger and linger, and it wouldn't go away.
How long have you had that back pain for?
This back pain has lasted me for the last 6 years. It started when I was working at the garden stores, doing a lot of heavy lifting. I took some time off from it, and then I jumped back into work, and the pain, just when COVID hit, I just had gotten a job in the garden, took another job in the garden store, and shot down my leg, and it's been like that. The pain's been like that for 2 years. So, you know, now it's 2023, and came here to see you, and yesterday we had it done, and in one day I'm doing a lot better now.
So you're back. You had the Duke laser disc repair done yesterday at L45-L5-S1. You could see us in there with a tiny 7mm incision, the endoscope, and the laser, cleaning out your disc. And clearly, to me, the disc did look injured, like they were about 5 to 10 years of injury. So it's been going on for a while for you. And you have degenerative disc disease. So a lot of people ask me, does the laser surgery work to get rid of back pain and leg pain when it's degenerative disc disease? What would you say? Sitting here now.
Yeah, I mean, my worry was that, you know, the disc had gotten just so bad that it wasn't really replaceable, that, you know, I was recommending a fusion, and I certainly did not want that. When the pain came on, I researched and found you and said, no, I don't have to do that. I don't want to have to do that. That's just not right.
Yeah, so you have degenerative disc disease at L45-L5-S1, but you had back pain coming from them. We did the laser surgery, we didn't do fusion. Is your back pain still there?
No, it's gone. It's gone.
Yeah, and the pain in your right leg, down the back of your right leg, is that still there?
That's gone.
Gone. Now, Is it gone because we put you on narcotic painkillers and you're loaded up on morphine right now?
Yep. No pain medicine, no anything.
So what did you take after the surgery? You took a Tylenol,
Tylenol,
Robaxin,
Robaxin.
and are you still
fact-
taking them, or are you using them?
I took them this morning. In fact, so I didn't even take them right after. Went to dinner after this, and yesterday went to the hotel, slept real well, and got back up. And
So no
things are looking
narcotics. You've been up walking around.
Yeah,
The surgery was
and
outpatient.
At 62, this is my time to really concentrate on my health and get back to the exercises and the walking I want to do, the swimming I want to do, the bicycle I want to do, the living, not the existing.
Exactly. Living, because
Not
you're
ex-
not limited by
still
pain
more.
anymore.
Yeah, and maybe I was a judge was good. We did disability over the phone because of COVID.